I'm Hannah, I'm the tech.
I'm Jasmine, I'm the patient.
I'm Kate, I'm the narrator.
And I'm Sarah, I'm the videographer.
Hi, Ms. White. I'm Hannah. I'll be your technologist. Can you verify your full name for me, please?
Jasmine White,
And your date of birth?
June 3rd, 1993.
Okay. And tell me what you're here for today.
I've been constipated for about a whole month now.
Okay.
So
All
I'm
right.
figure out what's wrong with me.
Okay, great. Well, we'll get you taken care of. So did your doctor give you any eating directions? So did you follow a low residue diet for the last couple of days?
Yes,
All right. And then did you eat after your evening meal last night? And have you had anything to eat or drink since midnight? Okay. And did you go with a cleansing enema last
Yes,
night?
ma'am.
Okay, good. All right, well then what we'll do is first I'll have you lay down on your back with your head on the pillow. And what I'm going to do is have, we've given you barium to drink, and we've waited about 15 minutes. And now we're going to just take some pictures of your insides and make sure we're going to turn you over some and take pictures at those different positions to make sure the inside's coated and we can see, whatever we need to see, okay?
The first projection is an AP of the small intestine. The cassette size is 14 by 17 lengthwise, and we've marked it on the right side. The patient is supine, and we're going to center MSP and 2 inches above the crest at the L2, since these films will be taken within the first 30 minutes. All subsequent films will be centered at the crest. The is 40, the KVP is 120, and the mass for CR is 16, and for DR is 8. The patient will suspend respiration at the end of expiration.
Okay, Ms. White, take a deep breath in, blow it all the way out, and hold it out. Beep.
The next projection is an AP projection of the large intestine. The cassette size is still 14 by 17 lengthwise. The patient is supine, and we're aligned with MSP to the table. The central ray is entering perpendicularly at the level of the crest and MSP. The technique for a single contrast is 100 to 120 kVp. For double, it is 80 to 90. The mass is 20 for CR and 10 for DR, and the SID is 40 inches. The next projection is an AP axial. The cassette size is still 14 by 17, or you can use an 11 by 14, but we have a 14 by 17 lengthwise. The patient is supine. We're going to center 2 inches above the crest, and MSP is aligned to the table. The central ray is at a cotted angle, and it's 30 to 40 degrees. The centering point enters 2 inches inferior to the ASIS. Our technique for a single contrast is 100 to 120 kVp and 80 to 90 for a double. Our mass is 32 for CR and 16 for DR. Our SID is 40 inches. The next projection is an AP oblique projection. The cassette size is still 14 by 17 lengthwise. The patient is going to be rotated into an LPO position by 35 to 45 degrees. The corresponding projection would be an RAOPA, and then you would center at the level of the crest and 1 to 2 inches lateral to MSP. But for the AP oblique projection, we're going to center at the level of the crest and 1 to 2 inches lateral to MSP on the elevated side. The technique is a single 100 to 120 kVp, or for the double, it's 80 to 90 kVp. The CR mass is 25, the DR mass is 12. Since we are in an LPO, the side that's elevated is the side of interest. In this case, it's the patient's right side, so we have marked their right side. The next position is an AP oblique projection in the RPO position, meaning that the left side is up, and that is our side of interest. The corresponding position would also be to do its PA and do an LAO position. For this projection, the cassette size is 14 by 17 lengthwise, and And we can see that Hannah has marked the left side, as that is the side that is up. They're going to be rotated, the patient will be rotated 35 to 45 degrees. The SID is 40. The KVP is 100 to 110 for a single and 120 for double. The mass is 25 for CR and 12 for DR. Centering is level of the crest and 1 to 2 inches lateral to the MSP on the elevated side. Our next projection is an AP right lateral decubitus. The cassette size is still 14 by 17 and it is crosswise. The patient's in a right lateral recumbent position. MSP is aligned to the cassette and we're marking the left side because it is the up side. The centering point is level of the crest and MSP. The central ray is horizontal and perpendicular. The technique for single contrast is 100 kVp and for a double it is 80 to 90. The mass is 25 for CR and 12.5 for DR and the SID is 40 inches. The next projection is the PA projection of the left lateral decubitus. The cassette size is still 14 by 17 and it is crosswise. We are marking the right side because the right side is up. The central ray is horizontal perpendicular. We are centering at the level of the crest and MSP. Technique is 100 kVp for single contrast and 80 to 90 kVp for double. The mass is 25 for CR and 12.5 for DR. SID is 40 inches. Our final projection is a left lateral rectum projection. The cassette size is a 10 by 12 lengthwise. We are marking the left side. The left side is down. The patient is aligned NCP to the table. The central ray is entered perpendicularly. The centering point is the level of the ASIS and NCP. For technique, for a single contrast study, it's 100 to 120 kVp, and for a double, it is 80 to 90. The SID is 40 inches. The mass for CR is 25, and the mass for DR is 12.5.